Hi, this is Dr. Peter Dobias, and today I would like to talk to you about allergies. And I have my little helper, my dog Sky, here. And I would like to share with you my experience about allergies. For years, I struggled with the treatment of allergies the same way as many of my colleagues do. And I didn't realize that allergies quite often are not really allergies, but there are some other conditions that mimic as allergies are often misdiagnosed. So many people are having a hard time to believe that 90% of all conditions diagnosed as allergies are actually not allergies. Many years back I was really frustrated with the number of skin conditions and digestive issues that dogs were coming with to my practice. And often I didn't really have a solution. My clients came with a long file, thick file of notes from other colleagues, and I felt like I didn't have anything else to offer. At one point, I started to look at my patients differently, and I started noticing that the location of skin lesions is closely related to spinal segments that are sore or somehow inflamed. I have developed a whole new system of treatment of allergies, and I would like to share it with you. So in the next several videos, I'm going to show you why so many allergies are misdiagnosed and how to treat them and how to address the number of different skin conditions that dogs come with and could be treated quite easily. I also want to empower you in the whole process, because I think that it's so important to give the power from the veterinary practitioner to the client and give you all the tools that you need to be able to address many of these conditions on your own or with the help of a veterinarian, but feel empowered and be able to make decisions that are much easier. Most people are feeling really helpless when it comes to skin conditions of dogs, and also veterinarians are in the same position, because I've been to conferences where hundreds and thousands of people and veterinarians gather every year to solve the number of different skin conditions. The question that we should be asking is why so many conditions are misdiagnosed and why so many of them are diagnosed as allergies. In veterinary medicine, we are often taught to see certain conditions as independent from the rest of the body. There is dermatologists, there is cardiologists, there is the gastrointestinal specialist and the ear and nose and throat specialist and the dentist. We have divided the body into bits and pieces while they actually have to function and exist all together, and they influence each other. So when it comes to skin, I know that the word allergies has been quite often used as an excuse for the more honest, I don't know what the hell is going on. And I must confess that many years ago, I didn't know how to address skin conditions, and I struggled with them. And I saw many patients coming back with the same problems over and over and over. But then I started looking at my patients from a little different point of view and decided to forget that there is just the skin lesion, the skin problem. I started looking deeper and started looking at the connections and discovered a whole new world that I would like to share with you. The first thing that I would like to talk to you is what I've learned about the spine and the skin and how they relate together. Let's forget about skin for a moment and let's imagine a garden. Beautiful garden that has beautiful garden beds. It's an organic garden. It has an amazing watering system that supplies the water perfectly. And then suddenly the gardener cuts off one of the branches of the watering system, and he doesn't notice. And suddenly he sees that the carrots or the lettuces or the parsley is not growing in that garden bed. And he starts looking around, and he discovers that indeed he actually dug into one of those hoses, and the hose is leaking, or it's basically interrupted. I would like you to imagine the body being a garden, and the spine is the main watering system, and the nerves and the energy lines or the meridians that lead to the different segments of skin and different organs are the branches of the watering system. And if the back gets injured, what happens? The energy lines get impinged, or the energy doesn't flow as well, and then the skin doesn't thrive. There may be some itching, there may be abnormal sensation, dogs will start licking or chewing, or just because the energy flow and the blood flow and the nerve flow is depleted, the skin is simply not going to thrive as well as some other areas. So what I've discovered is that when dogs do not get their spine properly aligned, and when it's inflamed or when it's injured, or when dogs run in the park like crazy and they injure certain portions of the back, then they start having skin lesions in the areas where the energy flow is not happening. Now I'm sure that you're curious how to recognize these congested spinal areas and what to do about that. So what you can do is very, very simple. You can just run your hands along your dog's spine and press your thumbs in each of the depression along the spine. Now, many dogs will actually twitch or react when you depress the area that is sensitive, congested, inflamed, or injured. Then what do? You run actually a line from that particular spinal segment to the skin lesion or to the area where the skin lesions are. And most of the time what you will see is that the injured spinal segment is actually related to the area where the skin lesions appear. Some dogs are quite amazing. They would have one part of the body with shiny and beautiful hair, and the second part, usually the back portion of the body, where the hair is more dull and kind of broken and dry, and that's past the particular segment that is injured. I would like to give you some examples of what I just described, and I will start from the head to tail and give you some common areas of location of skin problems and what they relate to. So the neck is, I say, a governing area of the whole body, and it affects many different parts of the front of the body. It affects the head. So if you have a dog that scratches or has skin issues around the head, usually I find that it's worthwhile to check the upper cervical spine, because usually there is a problem. Dogs that would play a lot of tug-of-war, or dogs that would fall and tumble over their neck and injure their neck. Sometimes dogs that actually rear on a leash, and the leash and collar end up in the upper portion of the neck, can suffer from neck injuries. When it comes to the lower portion of the neck, it actually affects the feet. So if you have skin lesions on the feet, usually it's coming from the lower cervical spine, and there is usually an injury of the C3 to C7, and sometimes even the front thoracic vertebrae. Dogs that lick their forearms would actually have a problem and tightness and energy flow decrease in the area of interscapular region in between the scapulae. Now dogs that would lick or scratch the front of the abdomen would have problems on the back portion of the chest. And I've seen many dogs that would have lumbar spine injuries, and they would actually lick the inner thighs and the abdominal region, and also the hind legs and feet. Some people may ask me, why is this not a common knowledge? And I have to tell you that I don't know. I think that part of it is that we sometimes do not see things the way they are, and we blindly follow textbooks or conventional medical wisdom. But our goal should be definitely to keep our minds open and assume that whatever we learn may or is different, because all you need to do is to look up to the stars and see that we know very little, and that we need to be open-minded and things possibly are not how we see them. So I hope that you will enjoy these video series, and also share them with others, because my goal is to empower you, and especially make your animal friend healthier and happier and less itchy. I hope you'll enjoy. Take care.